Williams, is she has no thyroid. You know, how many people have thyroid conditions, underactive, thyroid removal, they've just been told forever, you can't lose weight. Yes, you can, right? So if that is you, just understand that there's a lot more to weight loss than just your thyroid, okay? That's number one. Number two, you know, they're here as a couple, and I don't see a whole lot of couples in the room, but if you guys have other halves that are, you know, could possibly use something like this too, please feel free. You know, bring them along when you guys want to, you know, discuss the program with us, okay? So I want to bring Dr. Williams up next. She's going to talk a little bit. She has a couple topics. So.
Thanks, Dr. Stephan. All right, thank you. I'm Catherine Williams, Dr. Catherine Williams. It's hard to follow Stephanie and Levert. Those were great testimonials, but they actually touched on two things that I'm going to talk about today. And one of the things is keeping the weight off. That's one of the most common questions we get, and how do we do that? So we're really good at getting the weight off. We really help you guys do that. But one of the things that makes our program stand out, sorry, raise your hand if you can't hear me. One of the things that makes our program stand out is that people really keep the weight off with us. And the reason is this is a metabolic program, like Dr. Stephan stressed. So we talk about in your initial consultation what happened with your metabolism. Some people have metabolic issues their whole life, and for some people it's something that develops over time. We address that concern right from the get-go. Because it's a metabolic program, your body really wants to keep the weight off. You literally have to do work to put the weight back on. But maybe you don't know what to do when you're done with the program. Well, we come in with that, okay? So as you progress through the program, as you approach your goal, we talk to you about what foods you want to reintroduce to your diet. For some people it's bread, for some people it's dairy. These are things you kind of limit for certain parts of the program. Well, we work with you through that process. So we work with you as you reintroduce those foods. We find out what you can have, what foods in the right concentration, and that really is a way to keep the weight off long term. So it's really a lifestyle change. It's not a diet. We're looking at a way that you can lose weight long term and then transition that into a lifestyle diet, but it's not a diet. You'll talk to most of the people tonight and we'll just say this has become a lifestyle. Okay, so the second thing I want to talk about is the same thing Levert talked about, and that's why people come in. One of the most common reasons is because people want to get off of medications. So right here I have Susan. So Susan's a great example of someone who's lost the weight, kept it off long term, and has gotten off a ton of medications, okay? Now I want to start by saying we didn't prescribe any of those medications, so we work with your prescribing physicians. Dr. Stephan said we've been doing this for a really long time, a couple of years now. So most of the physicians in the area really know what we're doing, they're familiar with the program, and they know how to work with us, and we'll work with your prescribing physicians, okay? Some of the most common ones that we've reduced are things like blood pressure, cholesterol, diabetes medications, but also things like for your stomach, like acid reflux, stomach pain. One of the really cool things is joint pain as well. Just because when you eat better, it lowers inflammation in your body, well, that helps you digest your food, but it also helps your body feel better. So I want you to listen to Susan about what she has to say.
When I first came in, I had type 2 diabetes, and I was not looking so much for a weight loss goal as I wanted to try and get my diabetes under control, and if possible, get off of my diabetes medicines, which I did. I was taking 2 medicines for diabetes and 1 for cholesterol. I take no medications for my diabetes anymore. I'm controlling it with diet. I'm off of my cholesterol medicine. And one of the biggest impacts has been the fact that I was a chronic migraine sufferer and I've had no migraines for 11 months now. I can't say enough great things about this program. It has been fantastic. There's a great support base. Dr. Williams has been there to answer any question I had at any time. So I would highly recommend it to anybody who's looking for some changes in their health.
So just to recap, Susan's lost over 30 pounds at that point in 18 months. She's still migraine free. She doesn't take any migraine medication, and she actually at one point had a migraine that lasted over 2 months. She had a chronic migraine issue. So she no longer needs any medication for cholesterol, diabetes. She's actually off of her hormone replacement therapy, and she hasn't suffered from any of those migraines. So like Joanne said in the very beginning, this is a weight loss program, but this is a healthy gain program. What kind of health can you gain from this program? That's what we want to help you to do, okay? So that's my part. Thank you very much. Next, I'm going to go ahead and Dr. Stephan's going to take the mic again. We're going to talk to some more people.
Excellent.